First question, which ocular disorder would probably respond best to a multiple pinhole lens? Option A, advanced RP. Option B, advanced glaucoma. Option C, ARMD. And option D, corneal dystrophy. The correct answer is option C, ARMD. Second question, ERG testing provides information about option A, structure of retina. Option B, function of retina. Option C, both. And option D, none of them. And the correct answer is option B, function of retina. Third question, the part of eye that expands or contracts according to the amount of light available. Option A, lens. Option B, choroid. Option C, iris. And option D, conjunctiva. The correct answer is option C, iris. Fourth question, if right lateral rectus muscles paralysis occurs, squint will be option A, esophoria. Option B, exophoria. Option C, esotropia. And option D, exotropia. Correct option is option C, esotropia. Next question, which is incorrect about increased magnification? Option A, working distance decreases. Option B, field of vision decreases. Option C, both of them. And option D, none of them. Correct option is option D, none of them. Next question, grades of BSV can be tested by option A, keratometer. Option B, slit lamp. Option C, ophthalmoscope. And option D, synaptophore. Correct answer is option D, synaptophore. Next question, for cleaning protein deposits on lens, which method is better? Option A, chemical disinfection. Option B, thermal disinfection. Option C, both of them. And option D, none of them. Correct answer is option A, chemical disinfection. Next question, roughing, drying and smoothing of a glass are the stages of option A, marking. Option B, blocking. Option C, grinding. And option D, polishing. Correct answer is option C, grinding. Next question, multifocal lens are prescribed for option A, myopes. Option B, hypermetropic. Option C, astigmatism. And option D, presbyopes. Correct answer is option D, presbyopes. 10th question, vertex power of lens can be measured by option A, lensometer. Option B, retinoscope. Option C, tonometer. And option D, above all. Correct option A, lensometer. Next question, cellulose nitrate, cellulose acetate and cellulose propionate are the types of option A, plastic frames. Option B, nylon frames. Option C, metallic frames. And option D, none of them. Correct option A, plastic frames. Next question, which of the following are the type of rim? Option A, full frame. Option B, rimless. Option C, nylon supra. And option D, above all. Correct answer is option D, above all. Next question, thermosetting and thermoplastic are the types of option A, plastic frames. Option B, nylon frames. Option C, metallic frames. And option D, anodized aluminum. Correct answer is option A, plastic frames. Next question, which is not a property of ideal spectacle frame material? Option A, non-allergic and durable. Option B, adjustable. Option C, inexpensive. And option D, inflammable. Correct answer is option D, inflammable. Next question, the largest category of non-optical devices is probably which of the following? Option A, relative distance devices. Option B, writing devices. Option C, relative size devices. And option D, mobility devices. Correct answer is option C, relative size devices. Next question, magnification needed can be calculated if we know option A, new size and reference size. Option B, reference distance and new distance. Option C, both of them. And option D, none of them. Correct answer is option B, reference distance and new distance. Next question. When prism bounded by base to base, it will form option A, convex lens, option B, concave lens, option C, concave convex, and option D, convexo concave. Correct answer is option A, convex lens. Next question. Corticosteroid can be administered by option A, topically, option B, orally, option C, injections, and option D, above all. Correct answer is option D, above all. Next question. Which preparation of hyperosmotic agents administered orally and can be used in diabetic patients? Option A, glycerol, option B, mannitol, option C, urea, and option D, isosorbitol. Correct answer is option D, isosorbitol. Next question. Which is frequently used oral hyperosmotic agents? Option A, glycerol, option B, mannitol, option C, urea, and option D, isosorbitol. Correct answer is option A, glycerol. Next question. Prodrug form should be A, lipophilic, option B, hydrophilic, option C, both of them, and option D, none of them. Correct answer is option A, lipophilic. Next question. Which layer of cornea is hydrophilic and allow drugs to penetrate easily? Option A, epithelium, option B, stroma, option C, endothelium, and option D, none of them. Correct answer is option B, stroma. Next question. Which instrument can measure the thickness of cornea? Option A, tonometer, option B, keratometer, option C, slit lamp, and option D, pachymeter. Correct answer is option D, pachymeter. Next question. Which chemical injury considered more serious? Option A, acid burn, option B, alkali burn, option C, both of them, and option D, none of them. Correct answer is option B, alkali burn. Next question. Excessive secretion of tear is known as option A, hyperlacrimation, option B, epiphora, option C, both of them, and option D, none of them. Correct answer is option A, hyperlacrimation. Next question. Distance devices that may help the low vision patient include all of the following except option A, field awareness system, option B, spectacle and contact lens, option C, absorptive lenses and coating, and option D, microscopes. Correct answer is option D, microscopes. Next question. Most of the visual impairments in school-age children result from option A, accident or injury, option B, anoxia, option C, X-ray damage, and option D, heredity or fetal infection. Correct answer is option D, heredity or fetal infection. Next question. In which case front vertex power calculated? Option A, monofocal lens, option B, bifocal lens, option C, both of them, and option D, none of them. Correct answer is option B, bifocal lens. Black floaters seen in front of eye is a symptom of option A, corneal opacity, option B, cataract, option C, vitreous opacity, and option D, none of them. Correct answer is option C, vitreous opacity. Moving on to the last question of the session. Question number 30. Keratoconus is a option A, corneal degeneration, option B, corneal ectasia, option C, corneal dystrophy, and option D, none of them. Correct answer is option B, corneal ectasia. So please like, share and subscribe our videos. Thank you.